Hi, my name is Karina, and I just want to do a quick proposal on why we should have quality improvement in a veterinary clinic, and how this works towards professional and ethical veterinary nursing within a multidisciplinary team. So professionalism, ethics, and patient safety are keywords in this proposal, so just going through them here quickly. Professionalism is the standard to which you are held based on your knowledge, education, position, and responsibilities. So that is, you are a vet nurse, your knowledge has got you to that role. You are hired as a vet nurse based on the study you've done, which is your education and obviously the knowledge you have there. And your responsibilities should be outlined in a practice manual, and that is how you go forward as a vet nurse to care for your patients. Ethics requires considering all courses of action and choosing the one that will provide the best outcome with the least amount of harm. So often within the day you are having to choose how to do things for your patient in order to care for them. It's always often quite straightforward, but knowing the background as to why you're doing those things and having a look around and seeing if there might be an easier, better way of doing it that may provide better outcomes for your patient, that will provide less harm for your patient. So always considering, are we doing the right thing for them? We are given a trust by our clients when they give us their pets, and so fulfilling professionalism and ethical practice means that we are living up to the trust that they have. And for our patient safety, working in a professional manner and ethically means that they are going to be much better off. So the role of a veterinary nurse is to bring new knowledge into practice. We are patient advocates first and foremost, and so to do that we look at what we're doing for our patients and are always aiming to do the best for them. So we can also lead quality improvement in practice and communicate with everyone. Ideally, our role is quite central to the clinic and the care of our patients. We're there in the middle of everything, always looking out for our patients are central to our role, and so this gives us quite a good niche there in order to bring new information to the clinic, improve our care in many ways, and communicate with our staff members about perhaps ways we can improve as a whole, as a team. We're in charge of the daily organisation and management of the clinic, so we set up for surgery, set up for procedures, we also take everything down at the end of the day, and stock management, time management, all of those are quite central to our role as veterinary nurses. So having a framework is quite a good idea in order to clarify many of our roles. It outlines our key roles, responsibilities and achievements, such as if you are a veterinary nurse and you're on a hospital duties that day, your key roles is going to be treating your patient, assessing your patient, communicating with your vet, and taking back what you've discussed with your vet back to your patient, making sure that they have all that they need to be comfortable, pain-free, and improving health-wise. Obviously you can then assess your patient. Your role will also encompass clinically analysing your patient, you're taking vitals, you're making sure that nothing's changing, all the trends, and just general care of the patients and your underneath your care that day. Your achievements will be part of those roles and those responsibilities that need to be taken out. So your achievements should be, you've given the medication, your patient is comfortable at that point, you have made sure that they're nice and clean, you've communicated with the client, you've communicated with the vet. All of that is quite central to patient care as a veterinary nurse. And usually your responsibilities will be laid out in the practice manual, which is quite good because it provides clarity there. There's always already a part of that framework. You know what you need to perform, how you need to perform in that role that you've been given. The importance is that it provides good patient care. If you meet these responsibilities and achievements laid out for you in your role, your patient ideally should be getting the best possible care. So a quality improvement framework is a framework specific to improving the quality of your clinic. You evaluate your practice and systems, and you do so in a robust, systematic way. You don't just choose one thing out of nowhere and be like, yeah, I think we should fix that today. You choose something, you analyse if it's working, you study it, you take notes, you put down information, create data, and then assess the outcomes of doing it in that way, you look into other ways of doing it. So do a bit of research in the background, and then you can decide from there, we are doing it the right way, this is the best way to do it, or we should change things because that isn't working out and there are in fact better ways of doing it. So your aim is always to provide best current quality of care. There may be other things in the future that can be mean that what you're doing now is obsolete, but for now this is the most current knowledge out there and is obviously therefore the best way that we can do this. According to the Institute of Medicine Committee on Quality of Healthcare in America, quality involves 6 domains: safety, patient-centered care, good timing, efficacy, efficiency, and equitableness. I feel that most of that is self-explanatory, but it is key to forming a quality improvement framework, and those are the outcomes you are looking for once it is in place. So making a going into a quality improvement framework should be clinical auditing, so assessing, as I said, what is being done, whether it could be done better, as meeting the goal of good patient care. Benchmarking, which is comparing what we are doing to other people's, and in order to do that you have to be transparent about what you're doing, because hopefully someone else is also being transparent about their clinical outcomes as well, and therefore you can use those as a benchmark, being like, this is where we're at, but we could be there because they are there. This is apparently the gold standard in the industry and we can be there. Procedure manuals and guidelines outline the roles and responsibilities of the staff, and auditing significant events, and actually as well as morbidity and mortality audits, just a way of checking big events and making sure that everyone has done what they could, or we need to fix what went wrong. Has it gone well? Has it not? Therefore you can go back and do research into what kind of things could you have done better. Checklists, which help improve patient safety quite a bit. While you're doing a procedure, you can check off, have you done or have you got ready all these things that you require? Have you finished all these things? You just tick them off as you go along. There's 2 types of checklists. There's one sort of a pre-checklist where you have everything and then you tick off that you've got it all, or there is a checklist during procedure, so you can be ticking off, we need to do this, right, done. We need to do that as well, good, done that too. And then a lot of communication involvement between the client and the team, practice, your team, and just making sure that respect is always there in all forms of communication. You require empathy for someone, and not just, no criticizing, no prejudice, always just taking the time to understand what is making someone choose this, and whether that is the right thing to choose, or whether you can help them with better information. This is even between the client trying to get them to do certain procedures, or between the staff members themselves being like, they are doing this sort of behaviour, is that the right way to do? Go away, research it yourself, come back and be like, hey, I see what you're doing, but I did discover that we probably could be doing it like this, which is a slightly better way to do. Or you see what they're doing, they're like, hey, I didn't think of that, that is actually really cool. And then also accountability instead of blame. So you're always accountable for your own actions. You do something, that is your responsibility, that it's done. If it goes wrong, put your hand up, be like, hey, I did this, it's gone, nothing's gone right. So, or some things have gone right, some things haven't. And then getting other people to also take responsibility for things, and then coming as a group to discuss why we could fix it. Does it require training, or does it require just sort of a mix-up in the system? Instead of blaming something for it going wrong, be like, oh, she did this, what a useless person. So don't doing that, because that's not going to provide any sort of respect amongst the team. You're going to have sort of a breakdown of communication there, and no one will come forward, more things will go wrong, everyone will hide it, and therefore the patient quality goes down. The other important thing is that quality improvement framework provides clarity, as I mentioned before, with a framework. So in clinic, as a veterinary nurse, you can provide clinical leadership, especially in implementing a quality improvement framework. You take charge as a leader, this is something you're proud of, this is something you really want to introduce, and so you can bring it to the team. You don't have to be a team leader, you can just do all the research, bring it through, encourage other staff members to take things on board. Ongoing learning is important as a veterinary nurse, and you want to aim for that high standard of practice. So just, jump in there, say, I think we should be doing something, and sort of make sure you've got that, obviously, that information, that research to start with, and you can work on your team there and getting them to change. So introducing a framework to clinical practice does require the team. You're always going to have people who are just like, maybe not, but in the end you want your whole team to be on board. Sort of identify a team leader or a leadership group, so maybe yourself. You may find that someone else is more passionate about it, or there's a group of people who really want to get involved, and they can take charge from there. You define your clinical aims, your roles, responsibilities, and ethical requirements. Most of that will be in the NZVNA or animal welfare, and you can use that to start with your ethical and legal requirements, and then sort of define what your role is based on your education and your current responsibilities and experiences from there. And your clinical aims, which is usually going to be, in the end, patient outcome, improved patient outcome, but your aims may be better client communication, better team communication. There may be something specific to your clinic that you can put there as your final aim. So you've assessed what you already have in place that meets the goals. In many cases you will have a procedure manual that's already there. You can check to make sure it's all up to date, has everything you need. But you can sort of start with that as a role defining thing, and then you can work out what needs to come in, what you need to change to make it a proper framework. You want to use a planned action model to formalise the steps you need to implement changes, and then you measure your success or your failure. So it doesn't always stop. Once you've got something in place, see, is it working? What do you need to do to make it work? Do we need more people to be involved? Do we need to change this a little bit over here? Is it not quite working for us? Have we succeeded in implementing this or failing? And then you keep working on it. So you always something there that you can fix or make better. So there's quite a lot of barriers to success, and most of them are in the people involved. So belief in your own knowledge and traditions is often quite a big one. You've been working out in practice for so long now, this is how you do things, it's always been done that way, you haven't had a problem with it, your own knowledge says that this is the best way to go because this is the way you have been taught. And it's very hard to overcome that. Especially if there's a fear of new practices there as well, medications and procedures. There's often a fear of recrimination, especially if you've got a blame culture in clinic, which may be the first step to changing things, is removing that blame culture and just encouraging people to provide respect instead of blame, and poor communication. To overcome these barriers, you want to establish your goals with the whole team and with the clients. You need to work on changing your mindsets to a growth mindset. So always willing to change, to improve, to grow, rather than just sort of stagnating. So I know enough. You want to discuss the concerns, because if people are worried about how these changes are going to affect them, they may be very hesitant to put them in practice. And always using your robust research. We're a scientific-based profession, and so most people prefer to have a reason as to be changing, and that's often found in research. You can use that, like patient outcomes are known to be much better with a quality improvement framework. Client communication, client compliance is often much better with a quality improvement framework in place. And these would be the incentives. So your research could often provide your own incentives for changing. You can encourage interest in the team and ways for members to take leading roles so that they are invested in this. And so it's small steps and transparency, and it's absolutely worth it. If the change makes your patient outcomes better, then yes, you prevent avoidable harm, you have better practice, patient care, and evidence-based practice. Your other advantages are better client relationships, better team relationships, and the role of a valued vet nurse and team member. Just got some references there, and a lovely nurse to finish it off. Cool. That is everything, and I hope you enjoyed it. Threw in some pictures of my pets and clients, not clients, team members in there. So if you have any further questions, feel free